Hello and welcome to Yodo, a video channel devoted to providing education to people that want to learn in a less stressful environment about serious illness. I'm Dr. Sarah Bohn, and today I'm going to provide information about a medication called Naloxone. This medication will rapidly treat the potentially lethal condition of opioid toxicity by reversing the effects that occur on the nervous system, heart, and lungs when an opioid overdose occurs. As this channel has a series talking about pain and medications to treat the pain symptom, I thought it appropriate to discuss naloxone. We use opioids in hospice and palliative medicine to manage a variety of symptoms. I want you to have the information that you need about medication that will reverse the effects of opioid toxicity should it occur. Because opioid medications are being stolen or sold to people that are using these medications for recreational use and not for the intended purpose to manage those symptoms that occur with serious illness, it's resulted in the opioid epidemic in America, and there are many unnecessary deaths occurring in our nation. Opioids are appropriate, well-tolerated, and safe when they're taken as prescribed for patients with terminal disease. But opioid misuse and abuse have resulted in an unacceptable number of deaths of healthy individuals, and that number of deaths has increased dramatically since 1999. Proper use of naloxone can save a person's life. This life-saving medication is part of the harm reduction efforts to mitigate the number of overdose deaths from recreational use of opioids. The opioid epidemic is a worrisome and sad occurrence that's part of our culture at present time. That being said, naloxone is not typically a medication that is used for hospice or palliative patients. Use of naloxone on a patient that is at the end of life and dying has a very high potential to result in acute opioid withdrawal symptoms and can precipitate an acute, severe set of symptoms of pain and shortness of breath, really causing significant discomfort and agony at the end of life. The doses of opioids for hospice and palliative patients are specifically tailored for that patient that is taking the medication to manage those terrible symptoms. The doses are individualized, carefully calculated, and the patient has had the doses titrated and adjusted over time to manage their symptoms that are causing them to suffer. Physicians, nurse practitioners, and pharmacists use multiple strategies to ensure that the patient receives the necessary information, the correct dose of medication, and that the medication is kept secure from theft. Instructions are provided to the patient and their loved ones providing care about the medication. The information is reviewed often with a teach-back method being used by most providers, and the teach-back method is where the instructions are given both in written and verbal form, explained to the patient and their caregivers, and then that information is confirmed by the patient and family giving that information back to those providers so they can confirm understanding. In addition to the careful calculations, the deliberate titration of the medications, and ongoing education to the patient and caregivers, another level of safety is that patients receiving palliative or hospice care are provided only a few days of medication, typically 2 to 4 weeks. Due to all these safety measures, it is very rare that a hospice patient would ever be given naloxone. Very rare. When the end of life for a person is coming, and that patient has requested to remain in the family home and their loved ones are able to provide the level of care that is needed, and hospice is also assisting with them, hospice service is going to be sending their nurses, their aides, their medical team daily, if needed, to evaluate the patient, reassess the situation, and provide the necessary medication. These families are watching the patient nearing that end-of-life event. For some patients, the amount and the number of medications decreases as the end of life approaches, and the hospice staff are adjusting those medications daily as needed. Sometimes it's even more often. See the video that we have on the channel about continuous level of care provided by hospice. For today's video, I'm referring to individuals that are taking opioids as a person. They're not a patient. They're taking the opioids for an unintended reason. They have either bought, been given, or stolen those prescription medications. A person that is not being followed by a physician, that does not have a life-limiting illness, and is taking a patient's opioid medications for a non-medical reason, typically being used for recreational purpose, that is diversion. Diversion is any time that a prescription medication winds up in the hands of an unintended person. It is a criminal offense to steal or give away or sell these medications. Criminal charges at the state or federal level can be placed against people that are involved. It is a felony offense in some states to have another person's controlled medication in their possession. The security of the medication for opioids is of foremost importance to keep everyone safe. The patients have been provided the medication and the dose that's specific for the patient. These medications can be toxic to others and are strictly to be kept away from pets and children. When a patient calls their physician to report missing medications, they are instructed to report the missing opioid to the police for investigation as well. I am proud of the patients and their loved ones that I have cared for over the years of my practice because it has been very rare that diversion has ever occurred to my patients. Now to discuss naloxone, also called Narcan. This is the medication that reverses the effects of opioids when they're taken for recreational purposes. For a person that has evidence of opioid toxicity, this medication can be life-saving. As I stated above, it is rare for Narcan to be administered to a hospice patient at the end of life, as it will not revive someone that is dying from a chronic disease state, but it will likely increase their suffering and cause them significant harm. Opioids obtained illegally and used improperly by people that do not have a supervising physician or a medical condition that warrants the use of an opioid are at significant risk for the potential lethal side effects. These circumstances are when the rescue medication naloxone is needed to save their life. Naloxone, also known as Narcan, is to be kept in a readily available location for access if acute toxicity occurs in a person that is improperly using an opioid medication. If you suspect diversion, a person other than the patient has been taking the opioid medication, rapid intervention is warranted. You must contact 911. Opioids that have been diverted from the patient and are being used for recreation can lead to the life-threatening toxic side effects. The clinical triad for opioid toxicity, those symptoms are CNS depression, and that's when the person has a decreased level of consciousness, severe drowsiness, they're very difficult to arouse, they have confusion and acute memory impairment, and a slowed heart rate. There's respiratory depression. Breathing rates are slowed to 6 breaths or fewer per minute. The body has an overdrive mechanism for low oxygen levels to continue stimulating a person to breathe during sedation. However, when high opioid doses are used, that reflex is suppressed and the patient is no longer stimulated to breathe. The third symptom that is often noted, part of this triad, is very tiny size in pupils. Other evidence of opioid overdose can include other mental status changes such as euphoria, paranoia, or hallucinations. Symptoms can also include itchy skin with or without a rash, and some may have conjunctival injection where their eyes seem like they're more red than they usually should be. They can have trouble with symptoms of nausea, and even vomiting can occur, and youths, for individuals under the age of 18, seizures can occur. The person's life is at significant risk when these symptoms are noted, and it's extremely frightening. When suspicion is present that someone has inappropriately taken a patient's opioid medication and there are those clinical signs and symptoms of overdose, immediate action is needed. Delay of aggressive intervention or alerting the authorities under these circumstances can result in death of a healthy person. Narcan can be administered by anyone and does not require any medical training or authorization. It is available as 0.4 milligrams of naloxone delivered by an auto-inject device. This is safe to give in the upper lateral thigh area. It's effective both in the muscle, in a vein, or it could be given subcutaneously as well. The device for the auto-inject has a visual and voice instruction that will help guide the person who's administering the medication. There's also a naloxone that is available for a nasal spray form to be delivered. After administration, patients should be transported by ambulance emergently and observed in the emergency department for several hours to ensure that no repeat doses are needed. Naloxone works by blocking the opioid effect on the receptors, but it's only a temporary effect. Naloxone will typically last only 1 to 3 hours to block those effects of the opioid. The healthcare team in the emergency department will appreciate all information that's available about the drug that the person has taken and the route of administration. Narcan can also reverse the lethal side effects of heroin, fentanyl, as well as the prescription opioids. Due to the current opioid crisis in America, many states and pharmacies will provide Narcan medication without a prescription. Steps in the emergency would be to identify the individual, call 911, administer the naloxone, keep that person awake and breathing, and stay with them until emergency assistance arrives and transports them to a hospital for further evaluation and care. In summary, I hope this provides information to you. I want to reassure families and patients that opioids are safe and appropriate medication when they're used under the guidance of the physician and the palliative hospice care team. I want you to know that when being provided a prescription of naloxone, we're concerned for the public at large, and we want to ensure that if diversion occurs and a person takes someone else's opioids, that life-saving medication is available and that will reverse the toxic side effects of that opioid. We do definitely need to alert 911 and alert the authorities should something like that occur. Naloxone should definitely be administered if opioid toxicity in a person that is not under the care of a physician has occurred. People that take opioids for recreation are at significant risk for the toxic effects of the opioids. That is what diversion is. The illegal use of a person's medication carries significant consequences, including death. We all have a role to play in the safe use of opioids and limiting diversion. Please be mindful again that naloxone medication is rarely, if ever, used in palliative or hospice patients, as these medications are specifically customized to meet the patient's needs to manage their end-of-life symptoms and to provide that patient to remain as active and as functional as possible. As the natural end of life nears in a hospice patient, the care team from the hospice agency will be evaluating that patient, assisting the patient's loved ones, and meeting with them often in person and by phone to ensure that the appropriate medications are being continued and non-essential medications are stopped. The hospice agency medical team will be evaluating and adjusting the medication doses while providing ongoing education and support for the patient and their loved ones. I suspect this one was a tough one to hear. Talking about the taboo topic of diversion and unintended death due to opioid crisis in America is a very sensitive topic. Thank you for staying with me through this difficult talk. I do want our palliative and our hospice patients to have the medications that they need to manage their symptoms as their disease process advances and end of life nears. So please use their medications appropriately and follow the instructions of the care team. If you have specific questions about a script for naloxone that you may have in your home, please discuss that with your care team. We want to keep our patients' symptoms managed, and we want to keep our public safe at the same time. If you want to suggest a topic for the channel, please post it in a comment below. Thank you for being here. I appreciate your time. Bye now.